Now let me talk to you a little bit about dissociative identity disorder, because remember, this course is about integrating theology and psychology. Well, there are some concepts from psychology, especially those that deal with the brain, that help me understand dissociative identity disorder. Remember, these are very severe cases that have had some type of traumatic experience occur in their lives. For example, Mary having to watch her baby be killed. There could, cases of where children attempted to be killed by their parents. One mother tried to drown her daughter, and that certainly was an incredible trigger for her dissociative disorder. So basically, it's a brain sort of reaction to a very hostile or aversive environment, very similar to PTSD to some extent in terms of what the brain does to try to cope with this. And so the concept that I utilize is state-dependent learning. We've found through research that the brain tends to learn and record events in the world based on not just what happened, but the emotion that surrounded what happened. So, for example, think of a hard drive where the events, like if you're angry, the events of anger are recorded on part of the drive along with the emotion. So the next time you get angry, you'll tend to think of those thoughts that surrounded the anger event. The same way with trauma, we have memories that are isolated by the emotion of the trauma, and then we have our regular memories over here on the other side. And very often in dissociative identity disorder, there is a splitting, in a sense, of the personality. And basically, the way I conceptualize that is that the memories are consolidated in two different areas on the individual's, quote, hard drive. And they become so distinct that the individual isn't even aware of the other aspects of his personality at times, and learning sort of occurs in one state or the other, and that's how it gets set up. You might want to look at Wikipedia and look at the concept of state-dependent learning. It's fascinating. Also, there's a good summary on dissociative identity disorder in Wikipedia. So this is a case that normally what I'm going to try to do here is establish trust, and so it's going to be a very slow type of process. I'm not going to try to trigger events that could trigger this reaction over into the side where the stress, in the sense, stress-related side. I had a case once of a woman who came in. I've only had 2 or 3 cases of identity diffusion, dissociative identity disorder, basically. And one of those involved a woman who was a prostitute, or actually, sorry, a stripper, and she would come into the office, and when she was functioning within the modality of that aspects of her personality that was a stripper, she would be shaking the keys. I'd hear her out in the office. She was definitely agitated and upset. And when she would come in to see me, basically I knew she had dissociative identity disorder, and I refused to talk to the aspect of her personality that was this angry stripper. So eventually, when I refused long enough, she would, quote, switch back or go back to the other aspect of her personality, which was this wonderful Christian woman. And she had had trauma, severe trauma in her life as well. And that set up the distinction in the memory between these two separate identities, in a sense. Although I'd look at it as just different aspects. It's the same person, but it is very difficult if you're treating people like this and you start to refer to them as different people. That isn't helpful. These are just different aspects of her personality. So I use the concept of state-dependent learning when conceptualizing that. And I think it's very important to utilize the research that we have to understand a disorder. So my primary objective there would be to desensitize her, to develop trust so that her anxiety levels could come down, so that we could start allowing those memories from the other aspect of her personality to be integrated with the, quote, primary personality or host personality. So that's how I conceptualize that particular disorder. It's extremely difficult to work with. You can see, if you would start using prayer, that you might trigger some of the memories when she shuts her eyes, etc., and tries to pray. So we can use implicit prayer rather than explicit, which I use a lot because these cases you need to pray a lot for yourself.